We are at the magic hour of 5:30.
So
we'll call the meeting to order.
Okay.
And this is the September 13th meeting of the Ayer Board of Health. And the first item on the agenda here in open session is to go into executive session. Is there a motion to go into executive session?
Yes. I move that we enter into executive session to discuss litigation strategy with respect to the case of Mimi's Place LLC v. Board of Health of the Town of Ayer, Cal, Middlesex Superior Court CA 2181 CV 01197. If discussing the matter in open session will have a detrimental effect on the town's litigating position and the chair so declares. Does the chair so declare?
The chair declares.
Okay.
Is there a second to the motion?
I second the motion.
Motion's made and seconded, and polling the members, Pam?
Aye.
Trish?
Aye.
Steve? Aye.
Yeah.
Okay.
So the Board of Health is back in open session. Is there any public input? No one is here, and I'm hearing no one online, so we have no public input. So the next item on the agenda is an idling truck complaint from Alltown on Harvard Road. Bridget?
Yep. So we had a complaint that went through the building department regarding idling trucks at Alltown. I happened to be there when the complaint came in with Charlie, and I told him that under our regulations for air pollution that we could address the issue. So that's basically what we did. Steve had actually, I talked to him about it. He had gone and physically seen trucks idling as well and talked to the manager of the store. He was going to address it as much as he could. We also asked the Air Police Department to kind of follow up if they would not mind, because a lot of the issues were after hours. And it would just be easy to get documentation from them, which they did. We did follow up with a letter to Alltown, to the owners, included that police log as well. So we're just waiting to hear back from them.
What's idling? They have deliveries in the back of the building?
No, so the diesel pumps are in the back of the building. There's numerous diesel fuel stops. But what I think is happening, trucks are coming off the highway. And it's a convenient place. There's a lot of room. Well, maybe I'll take 4 hours and just kind of
staying there on the property.
So when Bridget mentioned this, I go down there for coffee in the morning. So the manager said to me, we only have one person on at night, but I'll try to do better. But I think that what's happening is the trucks are pulling over and staying there,
Sleep, getting a couple hours.
whatever. And I think we just need to be clear, this is not a truck stop.
Right.
I mean, if someone stops to get fuel and you leave your truck running for 15 minutes, I talked to the chief of police too, and he said, you know, part of it could have been because air conditioning in the summer, and, you know, to keep the cab cool, and I agree with that.
I get it.
But I think we need to make sure that the owners realize it's not a truck stop.
Right.
You know, it's not, you get your fuel, get whatever you're getting, and
they
you
think
get out
it
of
is,
there.
because it's easy to go in and do that. Is it the Markham Circle people that are being affected by this? Okay, you can go up behind.
But there are signs in the parking lot that says no idling, or I forget exactly what it says, but there's signs.
That's good, and that's what I was wondering, is if they need to put up a sign, or but they already have it. Okay.
So this is another one, we'll just have to see if they comply, and then if they don't, then we go to the next step, and that's filing a complaint against them. So. But hopefully they say, yeah, we'll take care of it. So. Anything else, Bridget?
So I didn't hear that last part.
Did I say something?
Did you hear that? I thought you said, did you hear that, Bridget?
Oh, I said no. Anything else, Bridget?
Do you have anything else to add?
Okay. So that's the complaint. Chief of police is aware of it. The police are just going by. You know, if we go by and you happen to look, if you go there, just keep your eye open for it. Okay. Next on the agenda is our favorite topic, COVID-19.
Oh, you want me to talk about that?
That would be nice.
COVID guru.
So it's not a good situation. We're finding obviously the younger kids. A lot of it is pertaining to sporting events, indoor gatherings, and again, mostly non-vaccinated. There are obviously continuously more breakthrough cases, but it's just one of those things where, I feel bad because the nurses are dealing with it every day. It could be 30 or 40 cases now a day, and they're dealing with the issues with the schools and the kids, trying to keep, everybody safe, get the kids quarantined that need to be, but it's a lot of work. So, again, it's a matter of parents really stepping up and making sure that they're not doing, if they're doing outdoor sports, that's great, but just make sure they're not carpooling with kids that aren't vaccinated, making sure that they're really paying attention to the indoor events that are going on with the kids. But again, it's a lot of community spread and, in houses as well.
Did you know if the Ayer schools are doing a pool testing for the kids? I know certain schools last spring were doing it.
I'm not sure if they're doing that. I can look into it.
I know at the height of it last year, where I am, they had extra nurses, and some of them might have been moms that were coming around, but they would have a list of, they had to get permission, and they would do it in the back of the classroom, and then it would go out.
I'm not sure. I can ask Tamara.
Yeah. I'm
but
sure
not
if they did, you
100%
would have
sure.
heard. I'm sure if they did, you would have heard about it. And I don't know if it's
I can ask
certain
her
areas.
tomorrow.
If certain areas that are high, that have higher numbers do it versus the
And
lower
my kids' school
numbers.
district's not.
No, they
And
didn't
it's
find
sporadic
out.
too.
They did
You'll
find
have
Bible.
You'll have one town that's high one week, and then and again, it's if you have a family of 6 and they all get it, that can drive a town's numbers right up.
Yeah.
So you'll have one town 1 week be really high. A couple of weeks ago, I think Pepperell was high, and now they're back down, at I would say maybe an average range, but it changes daily too. I mean, Lunenburg numbers were pretty high, I think, last week. Lancaster's numbers are pretty high. And again, it's just, who knows? It could be an event. It could be a family party. It could be something where a lot of people that were not vaccinated. It's just, it's crazy. But we're starting to see it more again in food establishments too, with staff, and that's becoming a problem for the restaurants.
Is the contact tracing still the same as it was before? The way that
The what?
the way that they did contact tracing in the spring, are they still able to do that?
It's not, because what they did is they started to basically dismantle everything, and I think they were getting ready to finish up with contact tracing, so they had to reboot the whole system all over again. So now it's in place, I've heard, until maybe December, and if they choose to extend that, I would hope so, but we don't know yet.
Are we listing testing locations anywhere for the general public? Is the website from Neshoba listing testing locations? Because I think that's important.
The testing locations, again, it changes, that changes by facility. I think the state might have that on mass.gov. You might be able to put in your zip code and get a location, but I'm just hearing that they're running out of tests, and that's the problem. So people need the test for travel. We're in allergy season, so anybody that has allergies, or if kids are having sniffles or something like that at school, they get sent home. They have to have a test. So keeping all that in mind, I just think that the actual getting the test can be difficult too.
I wonder if they're still doing, I'm thinking CVS never stopped.
I think some
I
are
know.
starting up again, they're stopping. Like I said, I've had a lot of luck online with mass.gov. there's a section, I think, where you can find out about testing and then also about the vaccine as well.
Are any of the towns putting on their website testing locations? And does Neshoba have any information if the towns did want to post that?
So because it's so fluid and changing, we just direct people to mass.gov. They seem to have better access at getting that information out there. So what I would do is put a link to mass.gov right on the town's website if it's not already there.
Do we know if it's
When-
there or not?
Yeah, it is.
I think
Oh,
we
yeah,
do.
I,
Okay.
yeah, we made sure we had that.
Bridget, do you see limiting participation in events based on vaccination documentation? Because I understand that they're talking about you're not going to be able to fly unless you can prove that you're vaccinated. And I totally, if someone doesn't want to get vaccinated, I don't have an issue with that. I have an issue with someone that doesn't want to get vaccinated that can contaminate somebody else. And that's a concern.
Yeah.
So Steve, at the very beginning you broke up, what was the,
I'm concerned, if someone doesn't want to get vaccinated, I respect that. Don't get vaccinated. But you shouldn't have the ability to infect someone else if you don't want to get vaccinated. Has there been any conversation at Neshoba about proof of vaccination for any type of events or anything?
no, again, we're following the directive of the state as far as the vaccines. I think, if I remember correctly, they might be mandating that all, I don't even want to say because I'm not 100% sure, but it's basically, it's directed by the state, and that's what we're following.
Because what I did hear was the federal government was going to come down on flying, that if you didn't have proof of vaccination, you would not be able to get on a commercial plane.
I heard that.
So,
I'm not sure I have not heard for sure how they're handling it.
okay.
I just checked the town's website, and it does, on the coronavirus section of Board of Health, has a where to get tested, and you click on that, and it brings you to the state's page and where you can find all that.
Oh, great.
Okay.
So it is on there.
Good, thank you.
You're welcome.
Okay. Hey, you guys have any thoughts on this at all, or?
No, I'm just watching it day by day because it's the same. I think that you're going to get to that point where they're going to say, you don't have your vaccine, you can't do this, you can't do that. And
Sometimes it seems like it's the only thing that's going to break
that's going to break
the
the cycle.
resistance. Yeah,
And
break the cycle.
I get it,
exactly.
but like in an airplane, if you're sitting next to someone that's not vaccinated, is a mask enough
Right, yeah.
versus,
Yeah, yeah.
a vaccine and a mask?
How about
Right.
an indoor sporting event or something like
Right.
that? The
And
same thing,
Going to the Bruins game
Yeah.
or something like that where it's not outside. And I just,
Yeah.
I think it's coming. I really do.
Well, it is. There's venues, like my sister was telling me she wants to go to the thing of going to the ballet, and the Boston Ballet, it's either negative test or vaccinated, and you have to be masked inside all the time.
Love it.
I just,
So she's like,
I love it.
And I said, I have a concert, it's not until
Yeah.
April, but same thing, that venue is negative test or proof of vaccination, and they won't let you in.
Yeah.
if we don't take steps
Yeah,
like that, this
yeah.
is just gonna keep going
So
and
that's happening a
going.
lot more
Yeah.
private
Mhm.
places, so.
Yeah.
And
Yeah.
from what I understand, just personally, the kids that are getting it, they're not really that sick, but they're spreading it because you don't know that they have it.
Yeah, the kids themselves.
So it's starting
aren't
all
getting
over
this.
again.
Yeah, yeah.
And I apologize if I'm not answering the question. I think I'm breaking up. I don't have the best signal. So I think, Steve, what I realized you were asking is if we've heard anything about planes and having to be mandated for vaccine.
Correct.
Mhm.
Yeah. I've heard that. I don't know where we're going with it. But, again, you're absolutely right. Part of the problem is people are getting too comfortable, and what's happening is the kids might be getting it, but then they're passing it on
That's
To-
what's happening
Yep.
already.
grandparents or other people that, again, have had the vaccine, but they're past 6 months.
Yeah.
Yep.
And I think, there's some what vaccine is better, I'm not sure, but there are a lot, the senior population was vaccinated back in January, so they're well over that, most of them are well over that 6-month period now. So it's tough, because again, and we're seeing that spread within the family. So if you have a family of 6 and they're not vaccinated, obviously the children under 12 can't be, but if the parents aren't, and they get sick, then they can pass it on, and that's where it just continues to just sort of snowball.
Right, exactly.
So, I don't know, I mean, it's just discouraging, it really is, because, again, it's starting to affect businesses again, because they're already short-staffed, so, and it's hard, because people are, how does a business know if somebody is truly vaccinated?
Right.
And you can present them, I don't know if a business right now has the right to actually ask for the vaccine card for an employee. So how do you know, so there might be staff that tells, their boss that they're vaccinated, but they're not. And they should be quarantined and they're not pulled off, out of work. It's very hard. And I know Tamara is very, I think, sad and discouraged, as, Maureen and Susan are. They're also the contact tracing nurses, because people are hanging up on them. They're not giving them information. They won't even tell them where they work. You can only fight that battle. If somebody hangs up on you, there's not a whole lot that you can do.
Well, it's very unfortunate, and I don't mean to get on my soapbox, but this has become a political issue and not a health issue. And that's the problem here, is that you can still, in some part of the universe, I guess, support Trump, but just get a vaccine. Just get the vaccine.
It's the people that feel like
it's like a loyalty test in a way to him.
you don't have the right to tell me to put something in my body that has only been around and invented within so many months, that doesn't have, we don't have that's what they're saying is, well, we don't know how 5 years from now I could grow another ear or something, you don't know. And they get all these crazy, reasons why they don't want to take the
There's
vaccine.
been an awful lot of new medications and vaccines put on the market, and when has such a thing happened?
But people get
But
caught
what's
up in
crazy is the state of Mississippi, I just read this morning, there are 9 diseases that your child has to be vaccinated against to go to school.
Right.
And Mississippi has one of the toughest laws in the nation, because it makes no account for religious objections, conscientious objectors, philosophical objectors, and yet they're fighting like hell not to have the COVID vaccine in that state.
That's
so
crazy.
that's how I mean it. It's become a political thing more than a health thing.
I don't know if maybe Steve or you, Richard, can answer this, and it's just, I'm curious. What are they saying for folks that had COVID, got both shots, the antibodies that they supposedly make after they have it, that supposedly they expire after 6 to 8 months, or is it the vaccine that expire? I'm confused about that.
The jury is out on whether or not
The antibodies.
and if you look at the different vaccines, the antibodies are made different ways based on the vaccine, the mRNA versus the Johnson & Johnson. So I don't think there's enough information out there to make a good decision.
Yeah.
But I think if there's anything that we can do as a Board of Health to protect people in the town of Ayer, I think we should keep an open mind to what that might be. And respecting people that don't want to get a vaccine, that's fine. But also keeping people safe.
Yeah.
I think we should just think about that, in terms of
I'm on board with that.
what can we do?
Yeah. And it would help, Bridget, if you hear of things that other towns might be doing, because it does feel like it's the endless cycle. We're just going into another long, cold winter of seclusion and nothing changing. So if you hear of any, of our local towns, any of the Neshoba towns, that are doing anything differently within town, and just tell us. It's
And
worth
how do we-
consideration.
I don't remember how it happened last time, but like I know I don't wear my mask outside, even when I'm
Yeah.
walking down the street, unless I'm really close. I wear it in the grocery store because that's iffy.
Yeah.
But there's some places in town, like even the little drugstore on Park Street, they say you have to wear a mask. Hannaford's hasn't started yet.
So
And I think they will.
healthcare facilities are required.
Healthcare
by-
facilities always.
So the drugstore, the dentist, the hospital,
Right.
Yeah.
you're
But
gonna have to have
What
masks
about,
on.
is it, the decision is made by the people who own these businesses?
No,
Whether they do
that's-
the masking, how do
That's
they?
state law.
So that's
But I-
gonna come down.
I believe private businesses, though, also have the ability, I know I've been in places that say you have to have masks to come in, and it's like, if you don't wear a mask, don't come in.
Yeah.
Yeah.
I think
Well, let's just keep our ears open in terms of what maybe
Yeah.
we can do.
Yeah. Absolutely.
Thank you, Bridget.
Welcome.
Thanks.
Thank you.
Neshoba update. Is there anything else for an update from Neshoba?
So I'm trying to think. So I did an inspection at Osawa. Heather, did I give you that envelope yet?
No, you didn't.
Yeah, so I did an inspection at Osawa, and I had to go back and do a re-inspection. And then it was a pretty lengthy list of violations. I'm going back again probably in another couple of weeks, but they did make improvements from between the first and second inspection. So that was the only one. And again, I don't know if, I think, well, you must all know now that where Carlin's was,
Yep.
that reopened as a new establishment.
Getting a lot of
So
business.
those,
Haven't been in it?
A lot of people are posting it.
but other than that, I did do an inspection at, I always mess up I think RFPD Junction, is that it?
Oh, it's the, what you said.
Oh, yeah.
Parthenon.
Yeah.
Parthenon.
Yeah.
Old Parthenon.
RPD
Yeah.
J, I think, I forget, but anyway, they had actually done some significant work in there without permits. The building inspector is subsequently involved in it now, and the plumbing inspector, as well as the electrical inspector and myself. So we'll be following up on that, but they were doing work without permits, so they had to submit a plan to us. They closed the bakery, and they're trying to add that component into the pizza place, so.
That's ongoing, right?
Ongoing, yeah.
Okay.
And then other than that, we had an application come in for testing for I don't know if the property is being subdivided, but it is on Fitchburg Road. It would be for a business, and it would be for septic. So I have to schedule that testing, but I have no information on the type of business yet.
So town surge doesn't go down Fitchburg Road, huh?
Town sewer, I think, stops somewhere after Shop and Save, maybe.
Interesting. Because I
I didn't realize
understand,
it stops that soon.
because there's talk of a development, a major development going in on that road.
Yes,
Oh, that's just what we need, no
Like
development.
Over 100 units.
yes, 40B.
Yeah,
Wow.
yeah.
How do you have the
So-
roof of that?
On the right-hand side of the road, there's a lot of acreage there where the
Flag.
wood,
Yeah.
yeah,
Kind of see that,
Oh,
yeah.
we're flat, we're.
flags,
okay.
yeah. And it was sold, I believe.
Huh.
That'll be coming up.
Yep.
Anything else, Bridget? Nope,
I think that is it.
it's enough.
I'm sorry.
Don't be, that's enough.
We've got the minutes from the
Yeah.
meeting of the 9th of August. So I read them over. I didn't have
I
any.
made the change on that.
You made the
I
change.
did, I'm sorry, and I
I'm
saved
sorry,
it,
but
so
I
it won't
made her
happen
make
again.
you chair.
Well, I texted you because I picked up the phone when I got the text from you.
Oh,
I was calling her.
Okay.
No, I'm out. I'm
I
out.
want me to make a motion?
Yeah.
I make a motion to accept the minutes from August 9th, the Air Board of Health meeting.
I second.
Motion's made in second. All those in favor?
Aye.
Tis a vote.
So do we want to all sign on the
Yeah.
one?
Yeah, which,
We can.
go ahead.
All right.
So administrative matters, we did have, and I'm sure you guys are aware, a complaint regarding trash receptacles. And there's been numerous emails, and
Yeah.
jump in whenever you'd like, but I was fairly certain that we had discussed this and resolved that we would monitor it. We weren't taking any action.
Right.
There's a town subcommittee looking at bylaws, and I talked to a member of that committee today, and he said they may come back with limiting the amount of time that someone can leave a receptacle out. So that you'd have to, you know, let's say you're picking up trash on Tuesday and you go to work at 7 in the morning, you put it out before you, and then
Yeah.
when you get home,
Yeah.
you take it back in again. So I'd like to see what the committee comes up with. The complaint that we had also said it was public safety. The chief of police is aware of that.
Yeah.
But in my own mind, I look around town, there are places without sidewalks that you don't have the ability. The location that we're talking about, there's always been room to go by even when the containers are out
Yeah.
there
Yeah.
and not have to get off the sidewalk. There's been other locations close to that where the barrels have been blocking the sidewalk.
Yeah.
But
Yeah.
as my feeling is right now is to continue monitoring and take no further action unless you feel as though we should do something else.
No, I agree with you. I think that if we have a situation where it's out there forever, for a whole week, they
Right.
only bring it in to fill it up and then bring it back, that would be a problem. But a 24 to 36 hours seems reasonable. I'd rather have the trash picked up.
In my thought, from a public health perspective, it's more important that the trash not be there.
Yeah, right,
than-
right. Let me give them that.
I mean, the other thing too, Steve, is that I think all of us, you know, can relate to the fact that sometimes when, you know, trash is delayed a day, whatever, and if somebody goes on vacation or goes away for a couple of days, you know, occasionally someone will leave a barrel out for, you know, an extra day or so. It's not an every week occurrence.
Right.
And,
Yeah.
you know, I always say life happens, and, you know, for whatever reason, somebody might, you know, even if they work a job where they might get called in for an extra shift and stay and work overnight, that might mean that the barrels don't get moved in or away as quick as possible. But, you know, again, this is definitely not an every week occurrence for sure.
Yeah.
I mean, we monitor that whole entire strip weekly. So I think that, you know, we have to respect the fact too that people are human, and you can't expect someone to have, you know, whatever emergency may come up, the barrel might not be moved in as quick as possible.
I think that as we go forward with this though, if there's anything that would be done, it would be done town-wide, not looking at street by street. You know, it
Makes
would be
sense.
whatever the town.
Yes, it should
Yeah.
be.
Town's
Right.
needs
Yeah, you
are.
can't
Yeah.
just pick and choose.
But are we on the same
Yeah.
page with this?
Oh, yeah,
And
I
absolutely.
am
We'll
absolutely.
continue to
Yeah.
monitor and.
Yeah,
Yep.
let's see what that
End of the
subcommittee,
story.
yeah.
Yeah, the bylaw thing is interesting though.
Yeah.
There might be a change there. so.
Yeah. Okay. We have no mail that I'm aware of. We do have a bill
Yeah.
from the show, but I think we should negotiate this though. It's $8,000. Can we, do we get a discount if it's paid early or?
Sure.
You heard that.
Jim's gonna kill me.
So it's for nursing service, $2,543.44, and environmental service, $5,573.43, for a total of $81,1687. Motion to pay the bill?
Yes, I will
Yes.
move to pay. the bill.
Second.
Seconded.
All those in favor?
Aye.
Aye.
So we all three sign it, or?
I think,
No, I just need chair.
I think
Just
you
do.
can just
Yeah,
sign
just do it.
yeah.
And I think all through COVID, I don't think anyone signed it, they just paid it anyway.
Oh, geez, yeah, I know.
That's true. We want Bridget to get her money.
Yeah.
Yeah.
Why don't you get paid, Bridget?
Action items for September 27th. So we may have to get together before that, depending on what we.
Yeah, yeah.
Do we want to bring the people in on the lorry?
Oh,
yeah.
Yeah,
We
Lori
wanna ask
Nearing
her
and
to-
Pace. They have a meeting Wednesday night that I was going to call in for. Pace does. So let me see what the email was interesting from Lori Nearing, because it just says, tune in because there's some information that's going to really put Ayer on the map in a good way. And I'm thinking, good, we will be on the map in a good way. So I don't know if that has to do with the PFAS study or not, because the other thing that I've been seeing is the RAB, the Reuse Advisory Board for Devon's.
Yeah.
So I'm still on all of those emails. I don't know if you.
I saw
if
them, I
you
didn't
still
read them
are?
in detail. There was,
Oh, I think I didn't print it because it was, well, maybe I did. There was an email that came out from, it's a cast of thousands.
yeah,
And this was from Lori, but it ties into the RAB thing. So they're asking everyone that wants to be on, to continue to be on the mailing list for RAB announcements. You have to go to this thing and click and sign up for, before November 1st, you have to do it, it says for the 2022 to 2024 term. So, yeah, I'm on it, Air Board of Health is.
Yeah.
Do you get these yourself? Okay. You can have this if you want, because you might.
Thank you.
Yeah, you probably should be. I'm gonna re-up my,
Okay.
notifications, but you may also wanna get them, because there are a lot of moving pieces over there.
If you think that it would be worthwhile to have her on the agenda for the 27th, we'll
Okay.
just do that.
Well, yeah, and we can kind of play it by what's going on with our other,
Okay.
project, but yeah, I can ask her if they're ready to
Okay.
come
I
back.
thought at one time we talked about having Lori come in on a semi-regular basis to keep us,
Mhm.
but then it got pushed out.
Yeah, and it got,
Because it would be good to
And
have her
COVID
come
happened.
in, yeah. And then, but, yeah, I'd like to get an update from her.
yeah, because I think things were slowed down a bit.
Yeah.
But now it's kind of moving forward again. And one of the RAB emails that I saw had something to do with like final cleanup plans for, they're all code AOC's area of concern,
Yeah.
50, this, that, and there were about 4 or 5 of them listed. So that one I do have to check again and see, is this their final report or what?
Well, let's keep it as a possibility then, and, maybe we
Yeah.
should have her come in quarterly
Yeah.
or something.
And
Okay.
I'm interested to hear, was the other lady that was on the Zoom calls a few times, that was coordinating the
Oh, she's the one,
studies
yes.
from Silent Spring.
Yep.
Lauren
Lauren.
and
Scheider?
Scheider, she was talking about hyenas, and she was talking about Ayer, and
Yeah.
at some point, a storefront being,
Yeah, just before the
yeah, and I was like
COVID
getting all like, yeah. I
wave,
mean,
yeah.
I think that would be great, because I know a lot of people want to be involved in that. But
Okay,
I'm sure
I-
that's been pushed out by at least a year.
Maybe.
Yeah,
I'll call into the PACE meeting on Wednesday.
Okay.
And then I can follow up
Great.
with Lori too. And then the RAB stuff is,
Yeah,
Lori's
that's-
very involved in that, but it
Yeah.
is really kind of a separate,
it is separate.
It's a separate-
But,
project,
Yeah.
but.
Maybe if there's like a quarterly update would be a good thing to do going forward.
with Lori,
Yeah,
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 okay.
yeah, okay.
all right.
Anything else for the 27th? Is there a motion to adjourn?
I've been making all the motions.
I make a motion to adjourn the September 13th meeting, the Board of Health meeting.
I second.
Motion's made and seconded. Any discussion?
No.
Hearing none. All those in favor?
Aye.
Meeting is adjourned.